Okay, today we're going to talk about what's known as GERD, or gastroesophageal reflux disease, or probably better known as acid reflux. Okay, this is a very common problem in this country. Probably 1 in 2 or 3 people have it. So someone you know has this problem. So the best place to start is the anatomy of the stomach or the digestive tract. So what you basically have is your stomach down here and a tube that goes into the stomach. Okay? The tube's called the esophagus. And in between the esophagus and the top of the stomach, there's a valve. The valve's called the lower esophageal sphincter. So it's a one-way valve. It's supposed to let food in and close. What happens often is the valve stays open. So when the valve stays open, acid comes up the tube. So let's look at like a gasoline engine and a lawnmower. You're out there pushing the lawnmower along and you take the gas cap off. It doesn't really matter whether the gas tank's full, 3/4 full, or half full. You're going to have gasoline come out the top of the cap and onto the lawnmower. It's the same thing happens with acid reflux. What does the medical doctor do? They give you proton pump inhibitors. What does that do? You know what? It decreases the acid in the stomach. What does that do? Decreases your symptoms. So your symptoms go away and you think you got everything solved. But what it really does is when it decreases your acid, you need your acid for so many things. The acid in your stomach is supposed to kill infections, whether they're parasites, fungus, viruses, or bacteria. When you ingest those infections, they're supposed to be killed by the immune system, which the first part of it, essentially, is the stomach acid in your stomach. So if you decrease that, you're decreasing your immunity. Decreasing stomach acid is one of the stupidest things that's done out there. And it's the conventional medical treatment. It's the wrong way to go. What we have to do is fix the broken flap. The flap stays open for a reason, because the muscle that holds it in place, so that little sphincter, is broken. But we have to take, how do we fix that little muscle? How do we fix that little sphincter? Well, understand that the esophagus goes into the stomach, but it also goes through the diaphragm. This whole structure here is your diaphragm. So that all that muscle there is your diaphragm. These, of course, is your rib cage and your spinal column. So you can see just how extensive it is. It goes right through your whole entire body. Right here, this area here that's wrapped around by the diaphragm is the opening for the esophagus. So you can see that if the diaphragm gets weaker, this opening can get bigger. In other words, that will not support or hold tight around the esophagus. But if this muscle is firm and strong, it tends to wrap around and support the tube. So that's why this is so critical. This has to be a functioning muscle. If we fix the big muscle, the big strong muscle, it will support and enable that little muscle to work. And if the little muscle works, what happens? We don't get any acid reflux. So an acid reflux problem is not an excess acid problem. It is a broken little flap, but a very dysfunctional diaphragm. So we have to fix the diaphragm to fix the little flap, which then will stay closed and hold the acid, regardless of how much acid we have in the stomach. Most people have very little acid. We have low acidity, not excess acidity. Again, symptoms of low acidity: bloating, gas from the back end, ridges on their fingernails, crack in the tongue, white tongue. Those are keynote symptoms that I look for in my office when people come in with issues. Okay? And again, the stomach acid is a big, big, big part of your immune system. So you're setting yourself up for failure if you do that. Plus, you cannot absorb your minerals and your proteins if they're poorly digested. So it's critical for absorption down the road in the small intestine to make sure you've got a properly functioning stomach. So again, the key approach is the diaphragm.